Hi, this session today is brought to you by the IVFN, and today we're talking about how employers can support their employees through baby loss. So, I'm Sarah Banks. I'm a qualified fertility support coach and mentor, and the author of the IVF Positivity Planner, and I work with clinics to help them better support their patients. So, the purpose of this session today is to understand the physical and emotional impact of baby loss, especially in the workplace, and highlight some of the implications of the organisation, how it can impact people at work, and why it's really important to support your employees through baby loss. I'm going to talk through how you can create a compassionate culture in the organisation that supports employees through challenging life events. We'll talk through some practical support strategies where you can support employees through miscarriage and baby loss, and discuss how you can be a good ally to your colleagues as well. So encouraging a supportive culture and having policies in place that support your employees through things like baby loss will ensure they feel supported, and they're much more likely to stay with their organisation if they have felt supported through what can be a really, really challenging time in their life. So why is it important that you support your colleagues and your employees through baby loss? It's often an unspoken topic in workplaces, but it affects a significant amount of employees. So awareness and support is crucial in the workplace. Sadly, miscarriage can happen in 1 in 4 pregnancies, and sadly, a significant number of your employees will have experienced a miscarriage at some point in their lives. Because 80% of miscarriages happen before the 12th week of pregnancy, most people haven't told anybody that they were pregnant, which means they often don't disclose that they've been through a miscarriage as well. So you may not even know that your employee has been through a miscarriage. So it's important to understand that these things can happen early on, and you may not have been told about it. And sadly, stillbirth happens in 1 in every 225 pregnancies. A stillbirth is the loss of a baby after 24 weeks gestation. So what is the impact of miscarriage and baby loss? So as I say, baby loss refers to the death of a baby at any stage in pregnancy or shortly after birth. So there are various descriptions of that. So miscarriage is the loss of a baby before 24 weeks. If the loss sadly happens after 24 weeks, it's classed as stillbirth. A neonatal death is loss of a baby within the first 28 days of their life. And then infant loss is classed as the death of a baby within the first year after birth. So it's important to understand these different definitions so that you can better support your employees with the exact type of loss they've been through. So the loss of a baby at any stage in pregnancy is devastating. And it can be a really lonely experience and really frightening, because if you haven't been through it before, you don't know what to expect. And if you have been through it before, then you know all too well what to expect. And it's frightening because you know what you've got coming. It can lead to feelings of shock because they hadn't been expecting it to happen. They'd assume that things would be fine. It can definitely lead to feelings of grief, loss, and an emptiness. There are really common feelings that can happen when you're experiencing baby loss. Many people feel that their grief isn't understood either by those around them, especially when it's an early loss. So, as I said, because people don't often disclose that they're pregnant before they've had a 12-week scan, many people don't disclose that they've actually had a miscarriage. So they don't get the support they need because they haven't told people. But even when they do, and it's an early loss, a lot of people don't always understand the really deep emotions that come with that loss. You might hear comments along the lines of, well, at least it was early, at least you know you can get pregnant. And many people feel they don't get the support they need because they didn't have a physical thing there. So they don't feel like they get the support that they would have had they had the baby and lost them at that stage. For some people, pregnancy loss can trigger mental health problems such as clinical depression or acute anxiety, or it can make existing mental health problems worse. But what's really, really important to understand is that everybody's experience of baby loss is different, and how it affects them is different. So the amount of time off they need is different, how it affects them personally, the physical effects are different. So you can't assume that because one person has reacted one way, that somebody else will react another way. So it's really important to understand that everybody has a different experience of loss. So baby loss can have a huge emotional and physical impact on the person going through it and their supporting partner. So in terms of physical, Depending on the stage of loss, there can be a lot involved in the recovery. So they may have to have a medical procedure, so they may need surgery. If the loss hasn't happened naturally, they may have to have surgery. They may also need labour induction for stillbirth, which is heartbreaking if you've grown that baby and then you still have to deliver it, but you know your baby won't survive afterwards. They may be having extended bleeding and pain. They may be going through a lot of hormonal changes that can mimic postnatal symptoms, which adds to the distress. So their body is still reacting as though they're pregnant, but they know that they're not. So it can be really upsetting to still have those ongoing symptoms. Those hormones could be fluctuating hugely, which means that they could be going through a really emotional roller coaster as their body adjusts to the hormone levels settling back down again. And they may just feel physically exhausted due to the impact that their body's going through from not sleeping due to the physical and emotional side effects. So it's really important to understand that it can be having a huge impact on that person's body that could affect them at work. And then emotionally, it has a huge, huge emotional impact. They may be experiencing deep emotional grief, that profound sadness that comes in waves. So it's sometimes they can seem fine, other times it's completely overwhelming. So understanding that it may take them time to come back into work because they want to get that grief under control or feel like they're at a point where they're happy to come back. They may be blaming themselves or feeling guilty and thinking that it's something they did that caused the pregnancy to end. And for many, it's an irrational guilt, but it's still guilt all the same, and it can be quite overwhelming at times. There can be a loss of identity. They were preparing themselves for parenthood, and suddenly that isn't happening to them, and it can cause them to question other things in their life. It causes a huge amount of fear and anxiety, especially about future pregnancies, about the possibility of loss. Again, I think before you've experienced loss, you wouldn't believe that it would happen to you. But once you have experienced loss, that is all you know. So many people feel very anxious about losing any future pregnancies as well. And then, as I mentioned before, it can lead to depression and that prolonged sadness and detachment, which can make it very difficult to function in their day-to-day lives. So how can it impact them at work? Employees will obviously need time off work to recover physically from a miscarriage, especially if they have to go through surgery, but they may also need time to recover emotionally as well. And it's important to understand those needs so that you can support them through that. If the baby is born after 24 weeks, your employee may be entitled to take their full maternity leave. So you will need to discuss that with them to find out how they're feeling and what their thoughts are on that. As I said before, it can be very different for everybody and completely personal about how much time they need off. So it will be a case of speaking to your employees to find out what they need. And it's really important to remember that partners will be grieving for the loss as well. So it's not just the female partner who has physically had the miscarriage. Their partner will be struggling as well, and they've lost their child as well. So it's really important to make sure you're supporting partners through baby loss as well. So it can be really difficult with emotional triggers at work. They may feel very emotional and be struggling to hold in those emotions at different points in the day. So that could be in a meeting that something suddenly triggers them. And it can be very difficult to hide those emotions when the grief is so deep. They might find if you work in a big office where there is lots of pregnancy announcements or baby showers or just talk of children, it can be really triggering when you're in those situations as well. So it's important to understand that it can be difficult coming back into work because of all the fears about that as well. Many people will feel worried about telling their manager about the miscarriage in case it affects how they're treated at work, and also in case it affects their future careers and things like that. And many people will feel the need to put on a brave face when they come in and be worrying about asking questions that they're not really ready to face asking about what happened and how they're feeling, because it's just the constant reminder. So many people feel worried about coming back and having to face those situations. And it's important to remember that this isn't something that just will happen and then they'll be okay. There are very long-term effects of this, so it's not uncommon for grief to resurface on significant dates, such as their due date, or anniversaries of the loss, or if somebody else around them has announced that they're pregnant, or when they have their baby. So things like that can resurface again. That grief is obviously still there, and things can trigger it in the future. So it's important to remember that this isn't something that will just go away. And it can affect their performance and their focus at work much longer than the immediate after effects of the event. So if you are sadly experiencing a miscarriage, what can you do when you're at work? How can you cope through this really challenging time? So have a think about what time you would like off, or what time you need off. Obviously, you wouldn't have any pre-warning of this, so take the time off that you need and have a think about how much time you'd need off, and speak to your manager about it to arrange a plan so that you don't have to worry about it. Arrange a plan for the time off that you'd like, and your return to work. So whether you'd like a phased return, whether you'd like to work from home for a bit so that you're not in an office environment or public facing, or in a position where you feel you will struggle to contain those emotions and continue to work. So could you look at phased returns or working from home for a bit? Are there any things that you need to help you with that transition period? So whether that is wearing your own clothes so you feel more comfortable if you are still feeling some of the physical after effects of the miscarriage. Could you access a quiet room for if you're feeling emotional and just want some time out to yourself? Is there a colleague that you could speak to who is understanding, or who has maybe been through it themselves, or knows how to support people who sadly experienced a loss? And could you have a look at reduction in your responsibilities as you recover? And that doesn't have to be a permanent thing. You could look at temporary reductions in your responsibilities as well. Have a think about what you want to tell people and how much you want to tell them. It's completely up to you. Do you want your manager to tell people so that you don't have to keep repeating yourself? Would you rather them not say anything to anybody and you talk to people when you come back? It's completely up to you. So have a think about what works for you. Be realistic with what you feel up to doing. Don't feel like you have to rush back into work, because you're much more likely to suffer afterwards and struggle through. Have a think about what's realistic for you to achieve physically and emotionally so that you're not rushing back into it. Have a think about some coping techniques that you could use at work, especially if you're feeling triggered. So whether that is breathing techniques, whether that's using relaxation tools or journaling, whether it's something like meditation that you could quietly take yourself away, just to manage some of those triggering emotions once you are back at work. And then it's really important to keep talking to your manager or HR or somebody you feel comfortable with, so that you can let them know if you're struggling or if you need more support, so that you can make sure in that immediate time afterwards, you're getting the support you need to help you transition back into work again. So what are the implications for the organisation of a colleague going through baby loss? So it can impact on your productivity. So obviously people are much more likely to be off. They're likely to be off straight afterwards because of the physical side of a miscarriage. But then they may also need time off due to the emotional side, so the exhaustion or the grief, and just needing that time to recover and process physically and emotionally. So you may find that people need that time off then, so physically time off. But you also might find that people are trying to push through their grief. They may come into work and say that they're fine, but actually they're not fully engaged, that they are still struggling to cope emotionally, and they're not there and engaged in the work. So actually taking that time off would be much more productive for you, but also help them recover from the loss that they've experienced. It can have a mental health impact as well. So it can cause longer term challenges such as anxiety and depression or post-traumatic stress, which might need longer term support and understanding from all those around your colleague as well. So it's good to understand that that's something you may need to put in place to help them. And then it can affect workplace engagement as well. So employees who feel unsupported are much more likely to disengage from their work and the culture. Whereas if you are empathic and supportive, then they will feel can trust you. They'll feel much more loyalty to you because you've supported them through something that's been a really challenging time for them. So it's really important to provide that empathic support so that you are highlighting to your employees that you are a supportive organisation, but also that that employee gets the support they need when they're going through that really heartbreaking loss for them. If you mishandle things like this, such as baby loss, but other health challenges as well, it can lead to resentment and higher turnover rates. If people aren't supported, they won't stay with your organisation if they feel you haven't supported them through that really challenging life event they've been through. So by understanding the impact of baby loss, you can make informed decisions on how to create a supportive work environment for employees, but just making sure that they also can recover from the loss in a way that they need as well, but then come back to you feeling supported and ready to be productive again at work. So it's really important to create that compassionate culture. And how you can do that is by encouraging open communication. So we know it's an uncomfortable topic. There is a taboo around it. People feel uncomfortable talking about it because they don't want to trigger anybody. It's something that's very sad and is very personal to people. But while we don't talk about it in workplace settings, it encourages and perpetuates that stigma around it. So then it's a bit of a vicious cycle. So normalizing these conversations around grief and loss in the workplace means that everybody is more accepting about it. People are much more open to talk about it and disclose that they've been through it so they can get the support that they need. So open communication sends a message that it's acknowledged and understood and that the organisation will support its employees through it as well. So it creates a culture of care and respect within the organisation. You can think of practical ways to initiate conversations. So participating in things like awareness days around Baby Loss Awareness Week can be a great way to open those conversations because you are encouraging people to talk about it. You're sharing that you are supportive around people who've experienced that. And you can do things like sending emails or hosting meetings to introduce it as a topic. And that could be, you could have somebody coming in and speaking about it as an event. You could just send an email around highlighting the resources that you've got, whether that is supportive booklets, anything that is in your company policy, where somebody that people could speak to, whether that is mental health champions or specific baby loss champions. Sending that email just opens that conversation and allows people to know that you as an organisation will support people through it. And then remove the stigma. So leaders in the organisation speaking out about loss or sharing personal stories, if they feel comfortable to, can help others feel more comfortable discussing it. So creating a culture where people feel they are safe to discuss it encourages others in the organisation to talk about it when they need to as well. So some example phrases for opening that conversation, because it can be really difficult. People don't like to start the conversation on this because they're afraid of saying something wrong. But it can be something as simple as, we want you to know that we understand it can be really painful and difficult experience, and we're here to support you. Or, we're so sorry for what you've been through. We're here to help you in any way we can. And if you were just talking generally, you say, if you're going through or been through baby loss, know that we're here for you and please reach out for support. There are ways you can have these conversations without it feeling too scary for managers, but still being safe and supportive for the employees as well. So if you create informal safe spaces, it gives employees a place to go when they need that support. So whether that is a support group specifically around baby loss, and that could be that's either peer-led or HR-led, somewhere where they can go and talk about what they've been through and how they're feeling without fear of judgment or fear of pressure in any way. So having support groups is a great way of getting peer support from others who completely understand what it is like. Have regular check-ins with your employees, just so that they know you haven't forgotten and that if there's any other support they need, they can access it. You can also ensure there's a private space where employees can go when they're feeling overwhelmed. So whether that is a quiet room or a well-being area that they can access, and this doesn't have to just be for baby loss, it can be for all different forms of loss or grief or different challenges that people are going through, but having a safe space where people can access can be a great way of them feeling comfortable coming back into work, because they know that if they need to take some time out, they can do safely. And normalize asking for support. So make it clear that accessing support is not just acceptable, but is encouraged. So whether that is going to see a counsellor, whether that's mental health support groups or programs, helping people understand that it's normal to need support and ask for support is really important. I think a lot of people know that it's there, but feel that they're not bad enough to need to access it. But encouraging them to access it before they get to crisis point is really important, because then they can get the support they need sooner. And communicate the resources clearly and confidentially as well. So if people want to access them confidentially, they're not having to ask somebody where they are, because then they fear they're having to disclose what they've been through. So giving them the information so they can access it confidentially is really important. So that could be the HR support, whether that's external counselling services or your employee assistance programs. Have a place where it is easily accessible, and communicate it regularly through staff support emails or wellness days, things like that. And provide empathy training to all managers to enable them to have compassionate conversations with grieving employees. And again, this doesn't just have to be around baby loss. This can cover a whole range of different topics, but enable them or give them the tools to approach the conversation with sensitivity so that they feel comfortable having the conversation, and it creates a safe space for the employee that they're having the conversation with. Help them understand that it's important to actively listen and not to try and just fix the situation. Listen to what your individual employee is telling you so that you can support that individual employee. Recognize and validate the employee's emotions. So as I talked about before, it's not about saying, well, at least it was early, at least you know you can get pregnant. So validating the emotions. I'm so sorry for what you're going through. I know it must be really difficult. And offering practical support, such as changes to responsibility. Having empathy training will help people understand what it's like to go through it if you haven't been through it yourself, to understand how deep some of those emotions can run, but also how you can then better support with practical and emotional support as well. So creating that compassionate culture not only supports the well-being of employees who are going through these challenges, but it highlights that you recognise and prioritise your employees' well-being. And it also makes these conversations easier for managers as well. If they've had that training, it makes it much easier to start those conversations. So languages and phrases to avoid are things like, it's for the best, at least you know you can get pregnant, at least it was early, at least I know somebody it happened to and they went on to get pregnant afterwards. Many people use these phrases to try and be reassuring, or because they don't know how best to address the situation. So they think they're being supportive, but actually it can be really triggering for the person that you're speaking to. So it's much better to be using phrases such as, I'm so sorry for your loss. Take the time you need. We're here to support you. Just let me know any way I can help you. I'm here to support you in any way I can. I can't imagine what you're going through, but I'm here if you want to talk. Just acknowledging what they've been through, acknowledging their loss, and letting them know that any way they need support, you're there for them. You're not making judgments. You're not assuming they feel a certain way. You're just letting them know that you're there for them. And that can be enough. You don't need to say too much, and that can be enough. So how can you support your employees after a loss? So look at offering flexible leave. As I've spoken about, it requires time for emotional and physical recovery. So look at the different ways that you could offer flexible or compassionate leave so that you're acknowledging the loss they've been through and allowing them the time to grieve and to recover in the way they need to do. So that could be if your organisation has pregnancy loss leave, extended sick leave or bereavement leave, or even flexible working, allowing them to reduce their hours, to work remotely, to do what they need to do in the immediate time afterwards. And for as long as they need to, you can talk that through with them. Communicate all these policies to your employees so that if they are facing a loss, because it can be so sudden, they can find the information, or they already know what they can expect. So they're not having to then start looking into all this information after they've suffered a loss. So make sure you're communicating this information with your employees as well. Look at return to work plans. So it can be incredibly difficult, as we've discussed. Many can feel emotionally fragile and very anxious about coming back to work. And whether that is because of the physical symptoms they're still having of the loss, whether that's the deep emotional side of things, or just not wanting to come back and face those questions. So have a look at a tailored return to work plan. As I said, everybody reacts differently, and some people might want to come back straight away because they feel like work is a distraction. Other people might find that it's too triggering and need a little bit of extra time off and that phased return. So look at a tailored return to work plan. Look at whether you could modify or reduce their responsibilities temporarily just to help them ease back that transition into work. And it's really important to maintain communication with employees. So once you've got that plan in place, keep checking in with them, because they may want to adjust it. They might find that it's working, they'd like it a bit longer, or actually they're feeling like they want to be back in work to have that distraction. So they'd like to come back in a bit sooner than they'd originally thought. So maintain that communication. It also shows that you fully support your employees as well. And then review your employee assistance programs to check the support after baby loss. And if you don't have one already in place, have a look at creating this resource. Communicate the details on how you can access the program, and remind your employees that it's confidential and part of their benefits packaged. So encourage them to access the support that's provided there, especially if they have counselling services included in it. Really encourage them to access that benefit, because it will help them recover, even if they just access the counselling for one session to see what it's like. Encourage them to access the support that's available to them. Then it's really important to maintain this ongoing support. So as I said, it's not just something that affects people immediately after the loss. It can have ongoing repercussions. So it's important to continue that emotional support and help employees recover and reintegrate back into work as well. So those continued check-ins, whether that be from a manager or HR. You could also have regular check-ins from a designated person who is a mental health champion or somebody who can support them and understand. So these touch points just allow employees to talk about any ongoing challenges they've got, request further support if needed, or make changes to the return to work plan if they feel that they want to. You could encourage mental health days for employees who need additional time to process their grief. And these mental health days could be taken at any point. And it may be that they would like to take this on the day that would be their baby's due date, and allowing them that flexibility and that option to do that, so they don't have to worry about being in work that day, then that could be a really great and supportive option for them. You could look at establishing an employee support group for those who've experienced baby loss. And depending on the size of your organisation, if you're a large organisation, this could be something that's really helpful to employees, because sadly, 1 in 4 could possibly have suffered a loss at some point. So they're a great space for creating a safe environment where it's non-judgmental. They can share experience and share coping strategies as well. So having an employee support group, or links to a trusted group as well if you don't want to create an in-house group. And consider developing a peer support system. So those who have experienced loss and are comfortable to talk about it and happy to support others, maybe would like to set up a peer support system where they would then go on to support other people who have sadly experienced loss as well. So you could, when you start having conversations around baby loss, you can talk to people about how comfortable they'd feel doing these things. But it's just really important to provide the ongoing support so that people know, even if they're struggling weeks, months, years after what they've been through, they can still access support if needed. So how can you be a good ally to your colleagues if they've sadly suffered a loss? So don't ignore the issue. It can be difficult to know what to say, but a simple "I'm so sorry for your loss" can be enough. And it will show that you care and you've acknowledged it, and your colleague will appreciate that. And you can then move on to whatever discussion you're having, but you've acknowledged it and they know you're there for them. Be empathic about what they've been through. They've lost their child at whatever stage it was at. It is heartbreaking for them. So put yourself in their shoes. Think how you would feel in that situation and the support you'd need. Ask them what support they'd like. Don't assume you know. Ask them what support they'd like and just be there for them. You don't need to push them to talk about it. Let them know you're there if you need to be, or if they want to talk, but they don't have to, because as I say, everybody's completely different. Some people will cope by talking a lot about it and acknowledging the baby that they've lost. Other people would rather not discuss it outside of their immediate family and their partner. So don't push them to talk about it, but give them that space if they'd like it. You could offer to take on some of their tasks if they're struggling and feeling overwhelmed, just to ease some of the workload and burden from them while they're recovering both physically and emotionally. And then remember that partners will be struggling too. So it's really important to make sure you're giving them the same level of emotional support. Check in with them, ask them how they'd like to be supported. Be sensitive around talking about pregnancies, babies, and children. And no one would expect everybody to never speak about their children again, but certainly immediately after it's happened, be sensitive to the conversations that you're having. Be aware of what they've been through so that you're not triggering them regularly and they're not having to pull away from all these discussions, because then it leaves them feeling more and more isolated. As we've already discussed, be mindful of the comments that you make. So it was only early, at least you can get pregnant, or it wasn't meant to be, can be extremely hurtful for the person on the receiving end of those, as well-meaning as they may be. And then signpost them to resources for them to access if needed. So if you know of some brilliant resource that you've seen or somebody you know has accessed, signpost them to those or to their company resources as well if they're not aware of them. So there's lots of places that you can get support if you sadly experienced a miscarriage or you'd like to signpost people towards more support. So the Miscarriage Association and Tommy's, SANS, Child Bereavement UK, you can speak to your GP to get referred for support services and counselling. There are a lot of very specifically trained private counsellors as well. So you could speak to somebody who's specifically trained in bereavement or baby loss. The Mariposa Trust and Saying Goodbye, which is run by Zoe Clark Coates, it's an amazing charity supporting people through baby loss. And there's also on Instagram a lot of accounts that are now doing brilliant support for people who've sadly suffered a loss. So the Worst Girl Gang Ever and Zoe Clark Coates are brilliant at supporting people through loss after experiencing their own. So they're great sources of support at whatever level of support you're needing. So I would definitely say access support at whatever level is right for you, but don't try and go through it on your own. So the key things to remember: create a culture of compassion and support in your organisation that allows people to seek that support when needed. If they already know that support is there before they've experienced loss, it makes the process, it takes away some of the worry and the fear when they're already going through a lot. They can then focus on recovering the way they need to do. Remember that everyone's experience of baby loss is different, so ask them how they'd like to be supported and what they need. Have a range of support services in place to ensure that all colleagues can access the support they need. So support can't be one size fits all. Have a range of support services so they can access what is right for them. And check in regularly with your colleagues to ensure they're coping and to make any further adjustments that are needed. And keep that as an ongoing process, checking in with them regularly, just wants to make sure you're doing all right. And if you'd like any further support, you can become a member of the IVFN.